Hi everyone, welcome to my presentation. It is on maternal mortality slash morbidity among Black women in Louisiana. So the problem is what can Warner L. Thompson, CEO, and Robert Hart, VP slash Chief Medical Officer of Ochsner Health System, do in order to reduce maternal mortality and morbidity among Black women in Louisiana? So Ochsner Health System, it is the largest health system in Louisiana. It pretty much dominates the entire market. They're constantly acquiring new hospitals that are going out of business. So by targeting Ochsner Health System, more likely this policy will target a larger population. Some background. Nationally, Black women face a maternal death rate almost 4 times higher than white women. Louisiana is not that different. According to a maternal mortality report from Louisiana, Black women were 4 times more likely to experience pregnancy or related deaths than white women. So, same thing. So throughout the years, actually, the maternal mortality ranking in Louisiana, it has decreased. In 2016, it was 46, and in 2019, Louisiana was ranked 50th in the country for maternal mortality. So you can definitely see how severe of a problem this is. So the common causes of pregnancy-related deaths in Louisiana, they are hemorrhage, cardiomyopathy, and cardiovascular disease. It was found that 62.5% of hemorrhage and cardiomyopathy deaths, they were found to be preventable. And also going off of maternal morbidity, Louisiana, they have a slightly above maternal morbidity rate. So the national average is 6.4 per thousand births. Louisiana has 6.8. So while it's not great, it's around the national average, which cannot be said for the maternal mortality. Another thing to note, implicit bias. It's been noted implicit bias is real. Especially in the medical field, it is especially crucial. So implicit bias in the medical field, it affects the quality of care. It also affects the treatment of patients. In one study, it was found that physicians were more likely to underestimate pain in Black patients 47% of the time versus 33% of the time for white patients. So you can see that that is a problem. My first option is hemorrhage cart. So adding hemorrhage carts in all of the eight Ochsner hospitals with NICU, OB, and well baby units. It was found that having a post hemorrhage cart in labor units or labor floors, it was found to reduce response time from 11 minutes to 4 minutes, and it had a 89% reduction distance traveled by providers and nurses, etc. So this option, it will lead to a decrease in response time and to find distance providers have to travel to find all the necessary equipment. By having all of this necessary equipment in one space, so a one-stop shop, if you will, in one cart, and hopefully it will lead to decrease hemorrhaging because it will lead to a quicker response time. So hemorrhage carts effectiveness will be measuring reduction of maternal mortality slash morbidity outcomes, focusing on hemorrhage preventable deaths yearly. Just to note, so hemorrhage carts, it will hopefully reduce overall maternal mortality slash morbidity. However, prevalence of anemia in Black women, it's 27% versus 7% in pregnant white women. So already Black women are at a higher risk of hemorrhage because they have a higher prevalence while pregnant. So while having hemorrhage carts will reduce the overall maternal mortality, it will also specifically reduce maternal mortality in Black women, which is what we want. So the cost, it's a high cost option. Implicit bias training. So we want to require implicit bias training to all maternity care staff every 5 years. The goal of this is a reduction of implicit bias in medical personnel, and hopefully it can improve equity of Black women delivering. And the effectiveness will an increase in quality of care lead to a reduction in maternal mortality slash morbidity in white women. It is the highest cost. It's 3,000 to 5,000 for 30 to 50 people. So you're looking at minimum $30,000. So it is a super high cost, but implicit bias, it is super, super important. And we want to see if implicit bias will have a correlation with quality of care, especially in Black women. Third option is joining the Louisiana Prenatal Quality Collaborative. So um, this is hospitals implementing variety evidence-based practices relating to hemorrhage and hypertension, and also reducing racial disparities in these outcomes. So it's a collaboration between all of the participating hospitals in Louisiana. They submit monthly reports to each other. Um, so hospitals that it was found in California, that hospitals that participated in California's version of this, they reported a 20.8% reduction of severe maternal morbidity. And another study showed that hospitals who also participated in California's version of this, they had a 9% reduction in Black women in morbidity, maternal morbidity, versus white women who only had 2.1% reduction. So this one study does show that joining this, it does have a positive impact on Black women mortality and morbidity. So the effectiveness, how much will it improve safe births and reduce mortality and morbidity in Black women versus white women? It's the lowest cost, minimal cost. Really, you're looking at staff and time of staff. My recommendation, requiring all the Ochsner hospitals with these units to participate in this collaboration. It's the least costly option, medium effectiveness. It can also grow. So it has space for all these hospitals to collaborate and grow and find different interventions. It does focus on overall mortality, but it focuses on making the racial disparity gap smaller by focusing on equity. And a study did show that there was a higher reduction percentage of maternal morbidity in Black women more than white women. I want to definitely focus on this to improve the quality of care, especially in the Ochsner Main Hospital, which is the largest branch, and it sees probably the highest volume of patients since it is located in New Orleans. So by definitely requiring Ochsner Main Hospital to be in this, since it does have such a high volume of patients, hopefully it will reduce maternal mortality and morbidity in Black women. And that is my presentation, and these are just my references. Yeah. Thank you, guys.